Is This Normal, Doc? A podcast sponsored by Tanner Clinic.
Hello, and welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. As always, I am your host. Tara is joining me as my co-host today. You might recognize our guest from a past episode. We have Katherine Jenkins here with us today. If you weren't watching that last episode, I'll give her the opportunity to tell us who she is and what she does.
I'm Katherine Jenkins. I work at the Tanner Clinic Parkway location in asthma, allergy, and immunology.
We had her on our last episode talking about environmental allergies. Today we're doing a slight shift and we're going to be talking about food allergies, so stay tuned for that. But first, we are going to get started with our new segment that we like to call, Is This Doc Normal? Our first question for you is, who is your favorite fictional doctor?
So I really like Dr. Robbie from The Pit.
I just started watching that.
Did you?
It's so good.
It's so good.
It's very good.
I will say that the first thing that popped into my mind was actually Dr. Quinn Medicine Woman, because I watched that when I was a kid.
Yes.
And I had no desire to be in medicine at all, but more up to date than that, Dr. Robbie from The Pit.
He has a little bit of trauma, but that's what makes
He
it more
does.
real.
But he also is so relatable, with his patients. So you relate to him as a viewer, but he also relates really well to his patients and to his staff. Mm-hmm. And the fact that he has trauma kind of makes him more human, right?
Oh, yeah,
Yeah.
for sure.
All right, so next question is, if you had an ice cream flavor named after you, what would it be?
So I don't like ice cream. Everyone's
That is blasphemous.
Yeah, I know. Everybody thinks it's so weird. I don't like ice cream or pasta. Yep. Hard pass. But if I was, do you want a specific name or what the flavor would be?
Whatever your heart is
So
telling you.
I would call it Blush and Burn, and it would be a pink vanilla with candied jalapenos and chocolate chunks.
That is so specific.
Right?
Have you had that combo before?
No, if I'm going to eat ice cream, it has to be a vanilla base. I love chocolate, but I don't like a chocolate. It's so rich. And then I love anything spicy. And I love jalapenos. So a candied jalapeno with some vanilla ice cream with just pink, because I love pink. It's my favorite color. And then chocolate chunks, because if you're going to have ice cream, you should have to eat it, chew it.
Yeah, I agree.
So the only ice cream I ever eat really is just frozen yogurt. And I only eat one kind. And we actually call it Candyland because it's mostly candy.
That's not a combo that I would have ever thought of.
Yeah.
So that's awesome.
It's sweet and spicy together, just with a smooth undertone.
Yeah.
Maybe I'll make it one day and bring you
I
guys
know.
some.
I was like, we should try some
Okay, I'm gonna
and then
do
give
that.
a
I'll
review.
I'll
Get
make
those
it for you.
jalapeno jams. Have you had that? Maybe you put that on top, because then it's the sweet and the jalapeno.
Yeah.
Okay, our next question is, if you had a theme song that played every time you walked into a room, what would it be?
It would be Unstoppable by Sia.
Oh,
Girl power.
Girl power. Yes. Being feminine but being strong. And I love that song because I think because of the patriarchy, there's lots of men and women, or women out there who just don't feel that kind of confidence they need. And I think if more people felt confident, more women felt confident, then we'd have a stronger feminine base in this world. So I like that song because it's just, I'm unstoppable.
Well, speaking of girls, we're going to talk about Goldilocks for a minute.
Okay.
Would you rather have food that's always a little too hot or a little too cold?
A little too hot for sure. I am an extremist when it comes to temperatures of things. So my water, any drinks have to be heavily iced. And food, if it's cold, other than I purposely eating cold pizza or something, it needs to be hot. I
Interesting.
like hot or cold. I'm not really kind of an in-between. So I'd rather
So you're not a
have it be hot.
Goldilocks then?
my conclusion is that you are normal.
Oh, yay.
I mean, the ice cream thing was a little bit weird, I will say. But everyone has that thing. I know people who don't like chocolate, so.
I know. My
At least you
sister-in-law
like
doesn't love chocolate, and I love her, but I don't understand that. Pasta and ice cream don't make me feel good, but give me a baked good any day, I will eat that till the cows come home.
So other than that, I feel like you're pretty normal.
Love it.
Yeah, everyone's got to have one flaw at least.
I have many.
So on to today's topic. Like I said before, we are going to be shifting to more of a food allergy scope for this episode with Katherine. And I think we're going to talk about what food allergies are, how, different treatments for them. I think we're going to talk a little bit about OIT, which is something that you do, and you can talk about what that is. So I'm excited.
All the things.
I think a lot of people confuse these three things. So can you clarify what the difference is between a food allergy, a food sensitivity, and a food irritation?
So this is probably my all-time favorite question because this is often confused, especially in the world nowadays. Diet culture, different approaches to medicine, this often gets very convoluted. And I have lots of new patients that come to my office convinced they have a food allergy when really they have an intolerance or sensitivity. And I actually just did a presentation to some of the APP providers here about just this last week. So a food allergy is an IgE-mediated allergy. It happens in your body with your IgE cells or different processes that way. It's a true allergy. It results in anaphylaxis. It happens every time you eat the specific food. You have to have an EpiPen on hand. It's very serious, life-threatening. Food intolerances and food sensitivities, many people have those. Not as many people have true food allergy, but intolerances and sensitivities are a big thing. They're very real. It's just that in our culture nowadays, people automatically think it's an allergy just because they don't understand the difference. So intolerance and sensitivity can kind of be used interchangeably. The way that I view it is intolerance is whenever I eat that food, I get bloating, stomach ache, cramping. I don't feel good. It kind of gives me the yuck. Maybe it inflames your throat. And so you avoid it because you kind of avoid it completely because you don't like it. That's me with milk. It's one of the reasons why I don't like ice cream. It makes me sick after, but I'm not allergic to it. I have milk baked into products or other things. I can eat it from time to time, but I know that when I do, I'm going to pay for it later. A sensitivity is similar to the intolerance because you get similar symptoms, but a lot of people that are sensitive can have some, like in a smaller quantity, and not have symptoms maybe every time if they have smaller quantities. But if they have it more and more in their diet, then they will have increase in those symptoms. Does that make sense? Yeah. So IgE, true food allergy, you cannot eat it, you'll have anaphylaxis. Tolerance and sensitivity, you can eat it. Some days it'll be fine. If you eat a lot, it's not great. And again, avoidance, most people do with both of those, but you strictly have to avoid a food allergy. Sensitivity, intolerance, people usually say, I can have cheese and yogurt and ice cream, but I can't drink straight milk. That's kind of
Do you find a lot of people have a sensitivity to dairy?
Yeah, that's probably the number one thing that brings people in.
I mean, we all know, like, if you have too much.
Yeah. And a lot of that, I mean, that can be a lactose issue. And so there's things you can do if lactose is the problem. Most of the time I tell people if it's a sensitivity, cut it out for like a week and then try a small amount. So the example I usually give my patients is, and ice cream is the thing I always use because everyone loves ice cream.
Yes.
But me. So say you had like one scoop of ice cream and you had that Sunday night with your family dinner. And then you go a week and you're like, oh, that's great. So the next Sunday night you have another scoop because you felt really great last week and it was fine. So you have that scoop the next Sunday night and you feel fine again. But then a couple days later you're at work and they're having a Sunday bar and you're like, well, it was fine when I did it on Sunday and last week, so I'm going to do it. And you have it and maybe you're like, but it's okay. So here comes the weekend, someone's birthday, they're having cake and ice cream. And so you're like, well, I've had it now 3 times and been fine. And you do it. And by then or the next time you have it, you feel terrible because you've had a huge quantity of it. Where if you stick to smaller quantities, not as often, you can tolerate it better. Your body just kind of has a harder time breaking it down over and over again.
So can food allergies develop later in life?
They can. It's less common for that to happen. But yes, we do see that happen occasionally with people. They'll come in. Oftentimes it's to random things rather than the typical food allergies that we see in kids and teenagers. But yes, you can develop an allergy at any time.
What about food intolerance?
So we often see that where, people will come in and say, like, I've eaten things my whole life. I've never had any issues. And now I have it. I used to feel like I saw people in their 40s and 50s coming in with this, and now I feel like it's getting younger. So I'm not entirely certain part of it is the American diet, for sure. We have different diets, not diets, but different guidance to food or eating that we'll give to people when they come in for this. But a lot of it is highly processed foods that are really rich, greasy, fatty. And there's lots of other problems. You can have gallbladder and other problems with that. But it's just, it seems like it's getting younger and younger that people are having a harder and harder time processing and digesting foods.
Are food allergies something that run in families?
So I see both. Sometimes we'll see a familial pattern. So a family will come in and they have a dad or a mom, a brother or a sister, and then the child that has food allergies. Sometimes people come in and they're bringing a baby or a toddler, and they'll say, like, we have no history of this. What have I done? A lot of moms will have mom guilt, thinking that they've done something when the baby was in utero that caused them to have this. So there's not really a predictive factor. There are things you can do to try to prevent it, but there's no real predictive factor of whether you will or will not have food allergy. But yes, I mean, I do see it familially, but I have seen a family of 4 kids and 3 of the 4 had allergies, but the 4th did not. So you never know.
Lucky genetics there.
Right?
Right. So what are the common symptoms of food allergies?
So moving forward, we're talking about IgE-mediated food allergy, not insensitivity. Not sensitivity. Oh, I said insensitivity. See, you want to mix them.
I know.
Not sensitivity.
Stop trying to make it happen, Hope.
Right.
It's not gonna happen.
So these are symptoms that people present with. And it is important to note that while your reactions can change over time, there are kind of the most common symptoms of anaphylaxis. So, and they affect different body systems. Anaphylaxis itself is determined by having 2 body systems or more affected when you eat or are exposed to your allergen. So most commonly, people will have nausea and vomiting, flushing, like full body flushing or hives, sudden profuse congestion. So like you go from being normal to like your nose is pouring. You can have this feeling of impending doom. We see that a lot in teenagers. And people always think that that's like funny and not real. It's real. It's that feeling of like something's wrong, but I'm not sure what's wrong. So it's and that's what they call it, is feeling of impending doom. And then obviously kind of the most serious is throat swelling, difficulty breathing. That's what most people associate with anaphylaxis. The problem with only associating breathing difficulties is there are many other things that can happen that really require epinephrine. And while breathing, the ABCs, airway, breathing, circulation is important and obviously life-threatening, there are other components that make a difference. And so it's important that people understand kind of all of the things that can happen.
So when do you use the EpiPen then? Like
2 body systems or more.
Okay.
Or if you feel like breathing is rapidly becoming a problem, go for it. Epi is adrenaline. So no one's allergic to epinephrine because we all have adrenaline in our body. What we're doing is giving you an adrenaline crash, making your cells work in a way that will decrease those symptoms. Hopefully it will make them go away completely. But if you do use epinephrine, you seek emergency help, and there are other medications that we give to help.
How soon after you eat the food you're allergic to do the symptoms show up?
So this is a good question. Most of the time it's within a few minutes to 30 minutes. It can be up to, 2 hours. Outside of that, it's really uncommon to have it later than that. There is something called a latent phase reaction where someone consumes something and it takes their body a little while to kind of understand that it's eating something that's foreign to it, because that's what the body is. Yeah. It's noting the allergen as something that's foreign instead of something that the body accepts. So we call that a latent phase reaction when it happens kind of outside of that typical time frame, but usually beyond 2 hours. If you think that we eat 3 times a day, typically, and a lot of times eat snacks in between. So your body is kind of always cooking through what you're eating, right? Yeah. You're putting it in your mouth. Within 30 minutes, digestion starts. It's breaking things down. It's absorbing what it needs. It's pushing into your lower intestines what it doesn't. And so outside of that, people will say, I ate something at breakfast and I had hives at dinner. Not associated with what you ate at breakfast. It's been too long. Your body's already processed that. It's moved on.
I didn't know it could take up to 2 hours.
Yeah, it's less common, but most of the time it's pretty immediate, within 15, 30 minutes, 45, but it can be longer than that.
I can imagine if you didn't know you had an allergy and then you eat something and then 2 hours later you have a reaction and you're like, what did I eat?
Yeah.
Like, what was it? So I have a friend that whenever she eats kiwis, she gets like an itchy tongue. Is that a food allergy?
That is something called oral allergy syndrome.
Okay.
So that's where typically fruits and vegetables, more commonly those with skins and rinds, they have a cross-reactivity to trees, grass, weeds, and so the body recognizes them. So people have environmental allergies, but then when they eat these fruits and vegetables uncooked, usually when they're cooked, they don't really have a problem or not as bad of a problem. Yeah. Usually, again, it's just GI symptoms, so itchy mouth, throat. Sometimes people can feel like their throat is swelling. If you have serious enough environmental allergies, you can go into anaphylaxis. That is less common, but that is something. But oral allergy syndrome is where your environmental allergies, your body is identifying the foods that have cross-reactivity as that, and so it's causing you to have a reaction that way.
So when I eat walnuts, I get cankers in my mouth. So is that like an intolerance or an allergy, or what is that?
So it's probably similar, oral allergy syndrome. The mucosa in your mouth is getting irritated by that. Do you have environmental allergies?
Yes.
Yeah. So you're probably having a component of OAS, oral allergy syndrome, or pollen-like syndrome.
I mean, that makes sense.
That.
Like, it's in a tree, and if you're allergic to the trees and all the pollens.
Some people, it will also depend on the time of year. So it could be where if things are blooming, it's worse, and maybe during the winter it's better. Or if they're cooked or candied, it doesn't bother you as much versus if they're fresh.
Yeah, the raw ones are not
The
good.
raw ones, yeah. Usually if it's raw, it causes people a problem most of the time. If it's cooked in some way, it changes the protein, and so then it's better.
I'm going to try to eat them in every season and see what happens.
There you go. Conduct your own research study.
There you go.
But you can take antihistamines to help that. If you're having issues and you really want to eat a food, you can take antihistamines. If you're having more serious symptoms, though, then you need to see an allergist.
So what should someone do if they eat something that they're allergic to? What's like the protocol?
So if they have a known food allergy, they should have antihistamines on hand. We prefer Zyrtec or Allegra. We do not really like Benadryl because Benadryl can cause somnolence or really deep sedation, sleeping, and that can affect cause you to be impaired. It can affect your judgment, and also if someone's in a reaction, we don't want them to go to sleep because then they could continue to react, and that's not safe.
Yeah.
So antihistamine, we prefer it be in a liquid form because liquid absorbs faster. If you do a pill form, it takes usually 20 to 30 minutes for your body to start breaking that down and digesting it. If a pill is all you have, that's great. If it's severe, then you need to give epinephrine and go to the emergency room. If this is a first-time allergy, then seeking emergency services is the best thing.
So if you think you have an allergy or if your kids have an allergy, how do you get diagnosed? What is the process?
So you come and see a board-certified allergist, allergy clinic, and there are a few different ways that we can diagnose food allergy. The one thing to keep in mind is testing is great. There's validated testing, unvalidated testing, and non-validated testing. It's important to know the distinction. People with IgE-mediated food allergy will need to either have skin prick testing or blood testing, and usually a combination of both.
Okay.
So if you brought, say, your child in and you thought for sure they had a peanut allergy, we would usually do a skin prick test on the back and see if they are positive to that. If they are positive, then the next steps that I take are to draw their blood IgE level that's specific to peanut protein.
Okay.
So when you have a food allergy, what you're allergic to is the protein in that food. So take peanuts, for example. Peanut allergy, you have to avoid peanut and peanut protein in any product. However, Chick-fil-A often gets brought up. Chick-fil-A food is cooked in peanut oil. Yeah. Oils are stripped derivatives, and it does not contain protein. So most of the time people can eat peanut oil cooked products without having a peanut allergy. But in order to determine whether or not that's safe, you need to come in and have testing and see someone who knows what they're talking about.
So Chick-fil-A fans rejoice.
Yes, I have had people do Chick-fil-A challenges in office just to make sure that they're okay with it. Yeah. Or I've had people come in and say, but they've been eating Chick-fil-A their whole life. I'm like, great, then keep eating Chick-fil-A, like you're fine. But, it just makes a difference what protein you're eating.
So my next question is, are food tests or food allergy tests reliable?
So that goes back to the validated, unvalidated, non-validated tests. So kind of three different kinds. The validated test that we use, again, skin prick testing, and then the IgE blood work. So when we look at that blood work, it gives us a numerical value and helps us to kind of interpret based on history and testing where the patient falls on the spectrum, but it gives us a true positive or negative. The thing that I hate the most is when people come in and they have thought that they had a food allergy, which is usually just a sensitivity or intolerance.
Yeah.
And they have spent hundreds or thousands of dollars at other places, and they've gotten IgG testing that comes back positive to 40, 50, 60 different foods. that can be really damaging because people will then think that they're allergic to everything. They eliminate so many things from their diet. They usually feel better because American diet is not great, right? Again, lots of processed foods, fast foods, greasy, high fat. And so when people will pull certain things out of their diet, they'll automatically feel better because the body doesn't have to work as hard to break it down.
Yeah.
But then no one can really sustain that for that long, right? When you can only eat, chicken, rice, broccoli, and that's not a joke. Like I have people come in and they're like, I have 5 foods and that's all they can eat.
Yeah.
After a while they get burnt out on that. And so they start incorporating back in only to realize that usually, they feel fine. And it goes back to that quantity and how clean is the food that you're eating. So those unvalidated tests where you're getting information back, but it's just showing that it's like more of a sensitivity test. And even then it's not ideally predicting that. It's just that your body has been sensitized to those foods because you've eaten them. Yeah. So it's not good information. And then there's other completely non-validated tests that are done by other, usually non-medical providers that give people poor information. So seeing someone who works in allergy and knows what they're doing is important.
So I had someone come up and ask me a question during one of our events that we were at, and I was obviously like, I don't know the answer, so I thought I'd ask you.
Okay.
She said her daughter went in for like a skin prick test, and she was like, I don't think that the results were correct because her hair was like swiping out. Maybe I'm saying this wrong, but her hair was like touching the spots, and she thought it gave like a bad reading or something.
So no hair should be touching it. The way that we do skin prick testing in our office, you need to do it on kind of any smooth surface. So you can do it on the arm, but because of the number of tests that we usually place, if it's foods, we're not placing a huge panel. We're placing the specific foods that someone potentially has an allergy to.
Yeah.
But regardless of what we're doing, if it's on the arm, nothing else is touching it. So the arm is clean. We put the skin prick test on. We let it sit for 10 or 15 minutes. We come back and read it, measure it, and then wipe it off. On the back, which is where we predominantly do it, a patient is in a gown. They're laying on their stomach. No hair should be touching it. If for some reason they were sitting and hair did that, there could be some smearing of the antigens that we use to do the prick testing. If that was the case, then you could follow that up with blood work to determine whether or not it was true or false.
Hopefully she watches this.
Hopefully.
I don't know if I'll ever see her
Come
again.
back in and we'll help you.
So we've learned a lot, and there's so much to talk about when it comes to food allergies. So I want to make this a 2-part episode. So let's wrap this up here, and they can come back and you can listen to the second part when we release our next episode. So make sure to stay tuned, and we will see you then.
Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal health care provider.